Hi everyone, Dr. Haider Ali here. We're going to talk about cough today. It's a very common symptom. I see it a lot in my clinic. Let's just unwrap it a little bit and get to know what's going on a little bit more. Okay, so we've all been there, right? You're in a quiet movie theater, an important meeting, or just trying to sleep, and suddenly you can't stop. It's annoying, it's disruptive. It sometimes actually hurts, especially when you've been coughing for a while. Welcome back. Today we are tackling something that everyone experiences, but very few people actually understand: the cough. Why do we do it? What is actually happening inside your chest? And most importantly, what can you actually do to make it stop? Let's break it down. First things first, we need to change how we think about coughing. A cough isn't the disease itself, it's a symptom. And more importantly, it's a vital protective reflex. Think of your cough as your body's dedicated security guard and the cleaning crew wrapped into one. The primary job of a cough is to clear your airways of all that stuff that shouldn't be there. That could be dust, it could be mucus from a cold, or even a piece of food that went down the wrong pipe. Without this reflex, our lungs would be in serious trouble, constantly filling up with gunk or foreign objects. So we kind of like the cough, but it can, get out of control and cause problems. So how does it actually work? Well, it's a pretty remarkable chain reaction. Your airways, your throat and lungs, are lined with thousands of tiny hypersensitive sensors called cough receptors. When something irritates these sensors, like, a virus causing inflammation or maybe some pollen, they immediately send a high-speed electrical message up to your brain, specifically to a part of your brainstem, sometimes called the cough center. Your brain gets the message and essentially says, intruder alert, evict immediately. It then coordinates a massive, explosive muscle contraction. You take a big breath in, your throat closes up tight to build up pressure, and then your chest and cough muscles squeeze incredibly hard, and then bang, your throat opens and air rushes out at speeds of up to 50 miles per hour to blow that irritant away. It's violent because it has to be effective. Generally, cough falls into two categories, and knowing which one you have helps you treat it. First is the dry, tickly cough. This is also called a non-productive cough because you aren't coughing anything up. This is usually caused by irritation or inflammation, like the lingering tickle after a cold, allergies, or asthma. It's like an itch you just can't scratch. Second is the wet, productive cough. This is the one where you are actually coughing up mucus or phlegm. This is your body actively trying to clear out the gunk caused by an infection like a cold, the flu, or bronchitis. So suppressing this kind of cough too much can actually be a bad idea because that gunk needs to come out. Okay, so how do we help our cleaning crew do its job without it driving us crazy? Well, here are some simple evidence-based home tips. I've said it before, I'll say it again, hydration is king. Seriously, drink tons of water. This thins out the mucus in your chest. It makes it much easier to get out of your lungs. Use a humidifier. Dry air makes irritation worse. Adding moisture to the air can soothe your throat and lungs, especially while you sleep. Honey. Honey is simple, it's cheap, surprisingly effective. It coats the throat and can soothe that tickle better than some over-the-counter medicines. But remember, never give honey to babies under 1 year old. What about stuff over the counter? Well, look at the ingredients. There's so many things out there in pharmacies now. For a wet cough, look for an expectorant called guaifenesin. This thins the mucus and again makes it easier to cough out. For a dry cough that's keeping you awake, look for a suppressant like dextromethorphan. This tells your brain to calm down the reflex, allowing you to get some sleep. Finally, and perhaps most importantly, a cough is usually harmless, but sometimes it's a warning sign. So you should really see a doctor if your cough is lasting more than 3 weeks, you're coughing up blood or pink tinged mucus, if you have shortness of breath or wheeze, or you have a high fever. But for most of us, that irritating cough is just your body's impressive, powerful way of keeping you healthy. Thanks for watching, guys. I hope this was helpful for you. And we're going to break down a few more topics like this in the coming weeks. So stay tuned and we'll see you next time. Bye now.